Truly a pleasure to be back and have a chance to moderate the Thieves Market. We had really quite a number of exceptional submissions this year, and in honesty, I whittled it down to 5, and I would have liked to have gotten it to 4, but I really couldn't figure out which case to eliminate, so I asked all 5 of the speakers to present their cases, and I've asked them to hold it to 10 to 12 minutes. And so we'll be mindful of the time. And the idea here was not so much to stump anybody, but rather to present cases that had a more unusual educational value. So the first case, and the only order was simply the order in which I received it by my email. So that was how that order was described. So the first case is going to be presented by Dr. Mariah Mansour from Thomas Jefferson University Hospital in Philadelphia, and she's going to present a 30-year-old lady with bizarre ulcerating lesions on her skin.
Good afternoon, everybody. Welcome to the last session of the day, but the best one. So this is about a 30-year-old lady with bizarre lesions on her skin. A 30-year-old African-American lady presented to our hospital with 8-month history of ulcerating, painful skin lesions and incapacitating joint pain in her knees and hands. The skin lesions first appear on the dorsum of her right hand, followed by wrists, left hand, and then shoulders. She also had severe fatigue and progressive shortness of breath on performing daily activities. Her PCP had prescribed her narcotics for joint pains, which did not help her. Her past medical history was unremarkable. Past surgical history was also unremarkable. Medication-wise, she took Percocet, and that's what her PCP had given her. She did not have any allergies. Family history was unremarkable. She was a student at Temple University. She lived with her son at home. She denied alcohol, smoking, or any illicit drug use. She denied any recent travel or any sick contacts at home. Review of system was positive for fatigue, severe joint pain, Raynaud's, and shortness of breath. Rest of the review of system was negative. On examination, she had a blood pressure of 123/80, pulse of 100 beats per minute, and a pulse ox of 92% on room air. On skin examination, she had round ulcerating lesions on her palms and dorsum of her hands, wrists, elbows, and shoulders. On chest examination, she had bilateral diffuse crackles on auscultation. On joint examination, she had swelling, pain, and tenderness in her PIP and MCP joints, as well as her wrist joints. She had knees and ankles. Her knees and ankles were warm and tender bilaterally. Range of motion of knees and ankles was limited secondary to pain. DIP, elbows, shoulders, and hips did not show any effusion, tenderness, warmth, erythema, and they had normal range of motion. Her power was 5 out of 5 in upper and lower extremities. Rest of the exam was within normal limits. So here's a picture of her hands. Let's go back. She has round ulcerating lesions on the dorsum of her hands, and notice some on her wrist as well, right here. This is the palmar aspect of her hand, and she also has round ulcerating lesions in the interphalangeal areas on the palmar aspects with some hyperkeratosis. These are further pictures right here of her wrists, of her elbows. So these are the pictures of her, this is the picture of her elbow, this is the wrist, this is the shoulder, wrist again, elbow. Here. This is the picture of her wrist, elbow, shoulder, wrist, and then this is the elbow. Initial workup was performed, including lab as well as imaging studies. CBC was unremarkable, BMP was unremarkable, mildly elevated AST and ALT of 40 and 41 respectively. ESR was high, 56. CRP was high, 37.